everyone, and thank you so much for coming today. I'm happy to be joined by Jennifer Mader, President of the Nurse Practitioner Association of Alberta, Dr. David Smythe from the Smythe Associate Clinic in Leduc, and Jody Cote, a new nurse practitioner who is now practicing right here at the Smythe Associate Clinic. I want to extend a special thank you to the clinic owners, Dr. David Smythe and Dr. Gurpreet Dinsa, for hosting us today, so thank you very much, and for all of their support of the Nursing Practitioner Primary Care Program. Congratulations to the clinic for also providing health care in Leduc for the past 70 years. That is an incredible accomplishment. Well done. I'm excited to provide an update on the success of the Nurse Practitioner Primary Care Program today. Alberta's government is laser focused on strengthening primary health care throughout our province. And we're doing this through a myriad of actions, including moving forward on recommendations from the Modernizing Alberta's Primary Healthcare System Initiative, or the MAPS initiative, providing stabilization funding for family physicians, introducing a rural and remote family medicine resident physician bursary pilot program, and most recently announcing primary health care grants to enhance access to care and attract more healthcare providers to our rural areas, and as well to expand integrated support services for vulnerable Albertans. So the Nurse Practitioner Primary Care Program that we launched in April is also an important part of our work to strengthen primary health care. Through the program, nurse practitioners provide primary care services that include diagnosing health conditions, ordering and interpreting test results, prescribing medications, and referring patients to specialists. The program provides compensation for nurse practitioners so that they can practice comprehensive patient care autonomously and operate their own practices. Or they can practice autonomously in existing primary care settings, just like this here at the Smythe Clinic, where we are today. I'm truly thrilled about the response we've received. As of November 12th, we received over 120 expressions of interest, which were followed by 67 applications, and 56 have been approved. 33 of these nurse practitioners are now practicing comprehensive patient care throughout the province autonomously through this program. Other nurse practitioners who have been approved are setting up their practice and are expected to get started in the next few months. And you will hear from a nurse practitioner, Jody Cote, in just a few moments. She is a new graduate who practices in this clinic through the Nurse Practitioner Primary Care Program. And with 33 nurse practitioners, just like Jody, working to build at least 900 patient panels on each of, as I said, on their panels, we have now more than 30,000 Albertans who will have access to a primary care provider when they didn't have access before. So this is great news for Albertans. Through this program, nurse practitioners are now practicing autonomously in 18 different communities across the province, in big cities like Edmonton and Calgary, but also in centres north, such as Fort McMurray, and all the way south to Coaldale. Simply put, nurse practitioners are part of the solution to expanding primary health care throughout our province, and they are an integral part of the healthcare team. I also want to congratulate all nurse practitioners on National Nurse Practitioner Week that was held from November 10th to 16th. Here in our province, it was a time to celebrate nurse practitioners and the wonderful work they do to improve the health and wellness of Albertans. A huge thank you to Jennifer and the NPAA, which is the association, for promoting the Nurse Practitioner Primary Care Program and supporting nurse practitioners throughout the process of adopting the new model. The program is bringing greater capacity to the system and giving Albertans more access to a regular primary care provider when and where they need it. The Nurse Practitioner Primary Care Program is an example of our work to refocus the healthcare system, to put the needs of patients at the center of the care of all that we do. And as we launch Primary Care Alberta, our goal is for every Albertan to have access to primary care no matter where they live. And that is exactly what our nurse practitioner program is working towards. And with that, I will now invite Jennifer Mader, President of the Nurse Practitioner Association of Alberta, to say a few words. So Jennifer, over to you.
Thank you. Good morning, everybody. It's my pleasure to join Minister Adriana LaGrange today to announce the launch of over 33 nurse practitioner practices across Alberta. The Nurse Practitioner Association has worked closely with Alberta Health since our last joint announcement in April to establish processes and procedures to support nurse practitioners in their applications to the Nurse Practitioner Primary Care Program. Since April, as Minister LaGrange said, we've seen over 120 expressions of interest from nurse practitioners across the province. 33 of those are now launched, and we'll see over 50 within the next year. As a result, we'll see over 50,000 patients within the next year with access to primary care services. This is a unique model that's the first of its kind to be offered to nurse practitioners across Canada. This model is an important step for nurse practitioners. It enables them to own and operate their practices, removing them from an employee-based model into one where they can be enabled to practice to their full scope. Most of these nurse practitioners are joining healthcare teams across the province, with a majority of them being established in our rural communities. The NP Primary Care Program will result in a large amount of Albertans within the next year and beyond to access primary care services. As we continue to work together and improve the nurse practitioner program, its implementation across the varied healthcare landscape, the program has the potential to attract hundreds of nurse practitioners to the province of Alberta and therefore serve hundreds of thousands of Albertans. I'm excited to see so much interest from the province in this program. Every week, I hear from a patient looking for care, a community looking for a nurse practitioner, a physician colleague willing to collaborate, and a nursing student willing to one day become a nurse practitioner. In order to meet this growing demand for NP services, it's essential that significant investment continue to be made in our education, training, and reimbursement supports for NPs that incentivizes the growth of this workforce that is rapidly trainable, cost-effective, and well-researched to provide high-quality care. It's truly an exciting time, and I'm passionate that with the right investment in primary care, we can improve the overall system cost and reduce our utilization of the acute care system. I look forward to continuing to work with Minister LaGrange and her team at Alberta Health to ensure the success and the sustainability of the nurse practitioner program, and I will continue to support all of our nurse practitioners across the province of Alberta. Thank you, and now I'll introduce Dr. David Smith.
Thank you. Well, thank you all for coming out today. And this is the Smith Clinic, and as the Minister said, the clinic was 70 years old last May, and we're a medical home to 18,000 Albertans. I'm second generation. My father immigrated from Ireland to start the clinic in 1954, and then my eldest daughter is now working here as well. So I'd hope that we can continue on and maybe make it 4 generations. About a year ago, I sold half the clinic to my colleague, Dr. Dinsa. He was a medical resident for me, and he's been invaluable. He brought in a new electronic medical record that was very difficult to do, and that record is great because it allows us to keep better contact with patients and their pharmacies. When you're in a medical clinic like this, it's considered private, but it's publicly funded. And it's basically an overhead game, because the higher your overhead, the less your take-home pay. And in the last couple of years, we've lost 5 family physicians, mostly to the hospital emergency departments, sedation for scoping, OR assist, and extender shifts, where they can make a lot more money and they don't pay any overhead. And when their day is done, and it's a much more comfortable lifestyle. So when we lost those doctors, of course, the overhead goes up per physician, and we had a couple of thousand patients that did not have a doctor anymore. And so we tried our best to place them, but it was very difficult because the doctors here were overwhelmed. So when I heard about the nurse practitioner program, I put an ad on LinkedIn, and I interviewed 5 nurse practitioners, all very well qualified. For one or another reason, 4 of them felt that they'd either like to stay where they are or they wouldn't go through with the program. But luckily, we found nurse practitioner Cote, and she was special. I knew when I talked to her because she had a lot of fire. She was highly motivated. And because it's a new program, there's a lot of paperwork to go through, and she went through it without any trouble. She even brought her mother-in-law in and renovated her office down the hall, and I think she has one of the nicest offices in the clinic now. So she's been very positive. She's always upbeat, and the patients are giving her great feedback, and they tell me they're very pleased with her. There was a man came in about a week or so ago complaining of pain, and he thought it was arthritis, but nurse practitioner Cote reviewed him, and she determined it wasn't arthritis. It was actually metastatic cancer that had gone to his hip, and she put the referral package together, and now he's getting the proper care. He wouldn't have had a family physician. If this would have been delayed much longer, likely the hip would have fractured, and it would be a pathologic fracture. So having her here certainly helped him. And she's trying to take new patients on and give them a medical home here in the Smith Clinic. She sees about 5 new patients a day, and I know the target for her is 900 patients to add to her panel. It might need to be adjusted because she's seeing some very complicated patients, and they take a little bit longer than others, but she's doing a great job with those. I encourage nurse practitioners, if they're thinking about going into medicine and practicing primary care, to join an existing clinic. We don't even like junior doctors to go out on their own because they need to collaborate. And we learn from her and she learns from us. She has some questions that aren't that easy to answer, and we discuss it amongst the group and try to come up with a consensus. And sometimes we can't even agree what to tell her. We know what the end result should be, but there's different ways to get there. So now, you know, when we started this, I even contacted our mayor, Bob Young, and he wrote me a letter welcoming Jody and saying how well she'd be treated in Leduc. I showed that to all the nurse practitioners. So everybody has been on board with this program, and we're very excited about it. And if there's other nurse practitioners out there, we can use one more to fill the last office we need. And so basically, this is historic in my time, and it's nice that it's happening in what is a historic building now. This building's over 100 years old, and we've been practicing here quite a bit. And I'd like to thank the minister and her office. They were most supportive in helping me be able to understand what was going on and try to speed up the process. But we're very pleased to get nurse practitioner Cote, and interestingly, her name is Jody Cote. The initials are JC. I don't know if that's telling, but I'd like to introduce nurse practitioner Cote at this time. Thank you very much.
Hello. Thank you all for taking the time to be here today at the Smith Associate Clinic. Thank you, Minister LaGrange, NPAA President Jennifer Mador, and the Smith team for accommodating all of us. My name is Jody Cote, and I'm an NP practicing independently out of the Family Practice Clinic here in Leduc. Many people ask what my role is at the clinic, and to summarize, I accept patients, people who do not have a primary care provider, into my patient panel. My role as a family NP is to give people of all ages, from newborn babies to older adults, access to care and to become that person's primary provider for their general health needs. A colleague of mine once described the role as being the quarterback to a person's care. This includes physicals, prescriptions, referrals, minor procedures, etc. Do I need a physician to oversee my practice? No. Do I like having a team of physicians down the hallway? Absolutely. Their knowledge and experience is invaluable to me. Where I am in my career as a junior NP, I cannot imagine not having my team of experienced providers available to consult with. This also includes my fellow NPs and colleagues and mentors. I am considered independent practice, but my work is not independent. The Smith Clinic is a long-standing, well-established clinic with available resources and support. I lean heavily on our nurses and our MOAs to guide me through the system. Their help and knowledge allow me to focus on my role as the provider. I also wanted to acknowledge the politics that may be involved with comparing an NP and a physician from my perspective. In short, we are different. We are trained differently. And this is what is so unique and wonderful about working as our team. I may approach care from a different lens because of my background in the nursing field. My MD colleagues may have different perspectives and approaches to care from their lenses. And that is okay. Being different is a foundation of formulating discussions and consulting with professionals from all of the backgrounds. Ultimately, as it stands, there are thousands of people without a family doctor in Alberta, and I can confirm from the little time I've spent here in independent community practice, people need help. This is where I come in and where my fellow NPs can assist moving forward. Thank you.
Okay, we now have some time for questions. If you could please state your name and outlet, and we'll be taking one question, one follow-up today. We have a mic in the back. We'll start in the room.
Hi, Sean Amato with City News for the Minister. So we have 33 practicing right now. Do you have a goal and sort of a timeline for how we're going to ramp this up? I believe the AMA says there's 800,000 Albertans without a family doctor. What percentage of that can be filled with nurse practitioners?
Well, if you look at the numbers that, roughly about 900 panel patients minimum is where we want to see nurse practitioners at. If you round that off to 1,000, the more nurse practitioners, right now we're looking at roughly about 30,000 that will, through the 33 nurse practitioners that we have. And then we have another 23 that have been approved that will be up and practicing in the next little while. So that alone is over 50,000. Out of that, and our numbers are roughly between 600,000 and 700,000. We have roughly 85% through CAHAD data. We have 85% of Albertans who do have a family practitioner. So that is a nice little chunk. We certainly want to see and encourage more nurse practitioners. We've seen great interest in the nurse practitioner program. For the 50 spots that were available at the U of A, they had over 1,000 nurses apply this year. So there's great interest. We want to make sure that, as I said earlier, we're using a multi-pronged approach, whether it's more family physicians, whether it's more nurse practitioners. We certainly want to encourage the nurse practitioner program, but we're willing to look at growing it as quickly as we can get the trained individuals to come. So I don't know, Jennifer, is there anything you'd like to add to that?
I think you nailed it.
Okay, thanks.
When it comes to the dollars and cents of this, how much money do taxpayers save by having a nurse practitioner do things that maybe a doctor used to do before but doesn't necessarily need a doctor to be done?
Well, you know what? It's not about saving money. It's about making sure that everyone is attached to a primary care provider and the right provider. And the great thing that you see happening here is that team-based care that, Jody will be able to do what she does. And if she feels she needs to ask the rest of the team, she'll get together with the rest of the team. It's really about making sure that every Albertan has the ability to be attached to a primary care provider, because we know when we look at the number of people that come through our emergency rooms, that a good number of them, and I've seen statistics that are upwards of 70% or better, could actually be handled by their primary care provider if they could get into a provider, or if the hours were available for them to get into a provider. Oftentimes, you may have a family doctor, but you can't get in, or a family nurse practitioner, but you won't be able to get into them right away. So we need to make sure that there's easy access so that it will actually save dollars at the emergency room and other areas of acute care. And the example that was given here earlier about the gentleman who was diagnosed quickly so that he can get the treatment that he needs, that will save lives. And that's the most important part, is saving lives.
Thanks, Sean. Do we have anyone else in the room?
And I just wanted to acknowledge my colleague here as well. I've got Chelsea Petrovic, who is my parliamentary secretary for healthcare workforce and the MLA for down south. Yep.
Eric Bay, Global News. Minister, we heard at the time that this program was announced from medical or healthcare groups, doctors groups, that there was still concerns that this doesn't provide, the full scope of medical care that, a primary care physician does. Just what's being done to address those gaps in the healthcare system?
Well, again, when we look at team-based care, making sure that we have the right person at the right time. We also know that through our pharmacy-led clinics that sometimes people just need to go see their doctor to renew a prescription. And the ability to have a pharmacy-led clinic where a pharmacist can actually indeed take that on so that allows for the family doctor or the family nurse practitioner who has a very busy panel to be able to see patients that are perhaps sicker or need a different level of care. It is really, as I said, a multi-pronged approach. We do have the primary care physician compensation funding model that it will be coming out shortly. We're working on the finalization of that. We've been working very closely with the Alberta Medical Association to make sure we get that right. And that will be something also that will incentivize more doctors and medical residents to stay within family medicine or to pursue family medicine. I'm very encouraged by what we're hearing. We brought, as I said earlier, the family resident bursary program where there's a return of service agreements that would be signed with family residents. We've also increased the resident physician program. Their actual funding was lagging way behind funding in the rest of Canada. So we've brought that up. We're able to negotiate a new contract with them. So there's many things we're doing. There is no silver bullet. So we have to do many different things to make sure that we are providing Albertans with choices that will meet their needs and provide good care. But there's more work to be done.
And just on that, just how is family physician recruitment going right now?
Well, I know when I first started, overall physician numbers were at, and that was only a year ago, June. Seems a lot longer. But in June of 2023, we had roughly about 10,600 physicians in the province. Roughly 5,600 were family physicians, not all practicing to full-time scope. I believe there's roughly about 3,600 or 3,800 of them at that time. What we're seeing now is we have over 12,100 physicians in the province, and we've seen an increase. I believe it was about 12% increase in family physicians. So the numbers are coming and going, I should say, going in the right direction. And I'm encouraged by what I hear when we roll out the new comprehensive primary care physician compensation program, that will encourage even more individuals to stay as family physicians, but also enter the program and become we've got a really great tax regime in Alberta. We have a wonderful place to work. We do have some challenges in that we're growing, which is a good challenge to have. More people are coming to Alberta. We've seen roughly about 300,000 people come to Alberta within the last couple of years alone, and every single one of them is going to, at some point in time, need health care. And so we know that we need to get those people attached. So I'm encouraged. I'm cautiously optimistic. I'm seeing the numbers going in the right direction.
Thanks.
Thank you.
Thank you. We'll move to the phones. Operator, can you put through our first caller, please?
Your first question comes from the line of Lisa Johnson from the Canadian Press. Please go ahead.
Hi, thanks for taking my question. This is for Minister LaGrange. Just in general on the healthcare refocusing, I know last year the government said that you're planning on standing up a procurement secretariat. It's meant to do, I guess, province-wide procurement like it was under AHS, but obviously AHS will no longer be the umbrella org that's responsible for procurement. So I'm wondering if you can offer some more details. If that plan has changed, how will government be organizing procurement? Who will be directly approving those procurement contracts? Will it be you? Will it be your office? And how will that be different after the refocusing?
Well, the procurement secretariat, it's procurement and optimization. It's really about making sure that we can use the purchasing power of the whole province, not just for AHS. AHS, while it was procuring, didn't necessarily pass the same opportunities along to whether it's continuing care or any some of the other health facilities that we have across the province. It really was more AHS focused. And so what we're looking to do is make sure that we have that ability for the whole province to have access. Everyone in healthcare, in a healthcare facility, should be able to, utilize, if they want to, the purchasing power of the province. So the Procurement and Optimization Secretariat is being set up. It has already started to be set up fully, and some of the individuals that are working in that department now actually have come from Alberta Health Services. So we're continuing to build that area. It will be responsible to the Integration Council and to the Ministry of Health, but I do not get involved with the contracts. There is a very detailed procurement process that has to be gone through, and there's checks and balances throughout that process. So RFPs, et cetera, depending on what the contracts are. But we want to make sure that we can actually, have, as I said earlier, the purchasing power of the whole province available to healthcare right across the whole province.
You have a follow-up, Lisa?
Okay, thanks for that. Yeah, hopefully your office can provide a more detailed, org chart of that and the people who are already working in it.
Sure. Happy to.
A follow-up question is slightly related. I'm hoping you can offer some more details about the Lyle Oberg review. These haven't really been forthcoming. Can you confirm that it's costing the province about $300,000? And will you be releasing his report publicly? I know the government has said that it's going to go to the Integration Council, I think. Yeah. But is it going to be released publicly?
Well, we're waiting to see that report. Lyle has got a very, big job ahead of him to look at the integration, but also the patient experience that's happening. It's a contract that we have to make sure that we get the information we need. And my understanding is that it is competitive with any other contract that we have to get a similar report put together. But I'm looking forward to getting that information because we want to certainly make sure that we understand the current patient experience as well as how we can enhance it. And so there's a lot of in-depth conversations, engagement, and targeted work that he's doing to get that report together for him. I'll make the decision on whether it gets released or not. I will certainly put out a summary of the information depending on how much volume is in the full report.
Thanks, Lisa. Operator, can you put through our next caller, please?
Your next question comes from the line of Jackie Carmichael from Edmonton Journal. Please go ahead.
Yeah, I have a question for Jody Cote. As a family MP, why did you prefer to be part of an existing clinic instead of starting your own?
Great question. I need the support in the sense of I don't know the community system very well, and I need to learn the process of how to refer people appropriately. I need to learn how our pharmacies work, how the medical EMRs are working. And so joining an established clinic who has all of the available resources at my fingertips, I can access the best knowledge, experience to provide the care for these patients versus me struggling through the system and starting up my own EMR, figuring out which is the best referral path to take. And there's a lot that goes on behind the scenes versus just, your half-hour patient appointment. It's behind the scenes, you're spending countless hours trying to figure out how to get access to the care that these patients need, these people. Does that answer your question?
Yeah, that's great. Thank you.
Yeah, you're welcome.
And a follow-up question for Minister LaGrange. Are there any obstacles to the primary care family physician funding model agreement being in place for the coming budget cycle?
Well, we're working through the details of that, and I'll be happy to give more information as soon as we have it. But as I said all along, we did provide stabilization funding to the tune of $157 million this year and another $100 million allocated next year. To make sure that as we worked through the processes that we did have that stabilization funding out to family physicians and rural generalists. And we are working diligently to get this new model up in place. We anticipate having it up and running for April 1st. But I again, a lot to go through, and we're trying to get that done as quickly as possible.
Thanks, Jackie. We'll take our last caller. Operator, can you put them through, please?
Your next question comes from the line of Meredith Kerr from Lakeland This Week. Please go ahead.
Hi, this question is for the minister. I see that a lot of the nurse practitioners that have been mentioned are in rural communities throughout the area. I'm just wondering if there's some clarification on if those practitioners are coming all kind of from the new graduate stream, or if there's a bit of robbing Peter to pay Paul, where they're coming maybe from the emergency rooms or continuing care or other places where we already had nurses working in those rural communities, and now they're kind of moving out of those places to set up the nurse practitioner practice.
Right. You know what? I'm going to actually probably turn that over to Jennifer. But before I do want to acknowledge that we do have, just so that everybody understands where the nurse practitioners are going, 12 are going to Calgary, Edmonton has 5, 6 to Central, 3 to North, 7 to South. And we have nurse practitioners now in Beaver Lodge, Black Falls, Brooks, Calgary, Coldale, Cold Lake, Consort, Edmonton, Fort McMurray, Leduc, Medicine Hat, Morley, Pitcher Butte, St. Albert, Three Hills, Two Hills, Bakerville, and Vermilion. And then the 23 other ones that are coming, I'll be interested to share that with you as well when we get to that point. We also have 9 nurse practitioners that will be working in Indigenous communities, and I think that is something worth noting as well. But I'm going to turn it over to Jennifer to answer the rest of your question as to where they're coming from. I think it's a little bit of both.
Thank you for the question. So Alberta has been unique in that most of our nurse practitioners that have graduated over the many years, a greater proportion of them have gone into the acute care setting just based on where the employment opportunities have been. If you compare that across the country, more nurse practitioners are in primary care than in acute care. So we do have a distributive issue where nurse practitioners have been mostly in acute care. We do have NPs who are trained to work in those settings, absolutely. However, many of them do have the family all ages background, and they have entered into acute care due to the opportunities available. This is now, with the NP primary care program, a new opportunity for them to move into primary care. Previously, their only other option was the NP support program funding, which was through the primary care networks, and that was not initiated by an NP to obtain employment, but would have had to have been applied for by a physician or the PCN. So this enables nurse practitioners to choose primary care based on their education and background. So some NPs who have been getting their employment from acute care may decide to move now into primary care. Some have been offering private services and will now move into the public system. Some, as your example, have been in emergency, but now that they're moving into the community, we can remove the high cost of the emergency department, and hopefully those patients will also flow out into the community rather than using the emerge as their point of contact. So hopefully that answers your question.
So to follow up, though, so then if we have those people coming out from the emergency or coming from that acute care setting and moving into the community, that's great that we're seeing those savings there. But then is there somebody who's going to then be able to fill that role in the emergency room, or are we going to have cases of beds in our hospitals then being closed because we don't have the nursing staff to be able to staff them anymore because they've moved into that primary care?
Yes, I see your question. I think we need to use our workforce with the right provider at the right point of contact. So there are many providers who work in the emergency setting. Just to continue with your example, there are physician assistants, there's registered nurses, there's physicians, there's social workers, there's a wide range of providers. So if we can distribute our providers in the right way, in a cost-effective way, hopefully we'll decrease utilization and we won't need as many in our acute care setting. So there will be an adjustment period, but we do need to evaluate our workforce and use the right provider at the right spot and time.
Thanks, Meredith. That's all the questions we have for today, so we'll leave it there. Thank you, everyone.